I hope I'm going to pronounce this, Mertrog.
Yep, Mertrog.
For his interesting talk. We can catch him before lunch. I'm sure you have many questions for the many that are working with small nanoparticles. Thank you again for your talk. Okay, the next person to present is coming from Argentina. It's Dr. Pablo Schodeller, if he's in the audience. And his talk is Nano-formulated enzymatic-based chemoadjuvant. And is currently in Loyola.
Okay. Thank you. Which is the laser? This one.
That's the laser.
Okay. Good morning, everyone. Thanks for coming. And I want to thank the organizers for inviting me. So I'm going to be talking about basically hyaluronidase. Hyaluronidase has a difficult name, so I'll refer to it as Hyal. So it's an enzyme that catalyzes the hydrolysis of the glycosidic bond in hyaluronic acid. It's a 60 kilodalton enzyme, and it's present in mammals. It's present in the head of the sperm, and this is Woody Allen dressed as a sperm. And the function in this case is to degrade the wall of the ovum. And actually the one I'm going to show, the one that we use in our experiments, is derived from bovine testes, so from the semen of the bull. Okay, so this is hyaluronic acid. It's a huge polymer. It's a linear polysaccharide. And actually the size reaches even up to 20 megadalton. And in length, it's up to microns. It has many roles, but one of the roles it has is to form and organize the extracellular matrix. It gives shape and sustainment to the tissues. And in most, or at least in many cancers, HA is overexpressed, and one of the best examples is probably in pancreatic tumor. And what you see here in brown is the stain for HA, and you see that in the normal pancreas there's almost nothing, and it's highly overexpressed in the cancer. And this poses a very large problem for treating these cancers for chemotherapy, because basically this is now like gel. It's something that's material that's difficult to wet. Let's say it's hard to access for a solution containing the drug. So that's why this enzyme hyaluronidase is used in treating cancers, and it's used, we say, as an adjuvant because it helps the diffusion of the drug. So first you would administer the enzyme, and then you would inject the drug. So that's up to now what is published. And we came up with the idea of doing a new formulation of this enzyme, and a nano formulation of this enzyme. And why? Well, the idea is that now if you have, in this case, if you have now a large particle with many enzymes in the surface, that will have a much larger affinity for the substrate, for the target, than the enzyme alone, because of basically the multivalency effect. Also, it's going to be a larger mass, so it's going to diffuse slower. So it's expected that it will be retained for a much longer time and degrade more the HA. So for that, we started with silica nanoparticles, mainly because they are easy to synthesize, and what we want here is just a scaffold. And the way we functionalize these particles with the enzyme is by the layer-by-layer self-assembly technique, and this is quite crucial because for enzymes, it's very important to retain their mobility inside this multi-layer so that they can interact with the substrate and be catalytically active. So the particles are negative. We incubate with a positive polymer, which can be any. In this case, it's polyallylamine. And then the enzyme will be negatively charged. So after that, we put a layer of the enzyme. And we know that this works because the size grows. The size in DLS grows with a number of deposition steps, and there's an alternation in the charge of the particles. Also, we know that the protein is there because we see the amide 1 and 2 bands of the protein in infrared. Also, the particles in TM, you can see the contrast between the soft matter and the dark matter, and by EDS, we can see the silicon peak. So we went ahead and we tested these particles as an adjuvant for a melanoma model, which is this model A375. And we checked first that it's highly expressing HA. So in blue, it's a stain for HA, which is Alcian blue, which is a typical stain. So this is the in vivo results. So in black is a treatment where we first supply the particles, and 2 hours later, when the substrate is expected to be degraded, we apply the chemotherapy, which we use the model drug, in this case, carboplatin. And it turned out that there's a regression here in the size, and the growth kinetics is much lower than the tumors that were treated with the enzyme alone. As controls, we injected the nanoparticles alone, and those had no effect. And the enzyme alone, those had no effect compared to the saline control. So this turned out to be significant at the end of the treatment, measured by tumor volume. By SEM, we can see a very different morphology in the surface of the tissue when those have been treated with particles compared to simple treatment. So first you can see the particles, and you can see these caves, so it's eating up the tumor from the outside. Also, these particles are active even 10 days after their fabrication when you leave them in room temperature. And we have checked that the enzyme does not desorb from that particle in this time. And with that, we published a paper, and that's the previous work. That's what I did in my postdoc in Argentina. Now I want to show what my present work in San Diego. And this I will be talking about basically the same particles, but for a different use. So in this case, it's going to be used for intraperitoneal chemotherapy. So many tumors, they form a metastasis in the peritoneum, and the way they are treated in the clinic is that you inject or circulate the drug peritoneally. So you wet the tumor from the outside. And what you see here are histological sections of kidney, liver, spleen, so the different organs, and the tumor. And this is what you see in blue is the content of hyaluronic acid. So you see that it's a huge presence that is not there in the control organ. So we thought that if you can access this tumor by injecting the particles from the outside, and those will bind the hyaluronic acid, then you will have something that's specific to the tumor. Also, if you think as the HA as a receptor, there's a large amount of excess of a receptor, which is something that is not always, or is never the case in a synaptic targeting. So first, by seeing that previous image, we prepared a surface of HA covered with hyaluronic acid, basically to mimic the tumor surface. And what you see here is that these particles with, and now they are fluorescent, only the particles that have the enzyme in the surface, they bind, they stick to this surface. The controls do not. And also this binding seems to be activity related, because when I inhibit the enzyme with this, which is a specific inhibitor for hyaluronidase, I see no binding. And this is very important. This is the surface of HA. So in this region, I put 20 units of the immobilized enzyme, and here I put 20 units of the free enzyme. And when I stain for HA, I see that there is nothing here, which is indicating that only this place was degraded by the enzyme. So that's a large difference. I did the first ex vivo, so I grew the tumors, I took them out, I incubate with the enzyme. I see that they bind only to the particles with the hyaluronidase, not in the controls, not in the inhibited enzyme, and there's nothing in the organs. These are all the organs cut in little pieces, so there's nothing there. And the histology of that is seen here, and you can see that these particles here, they penetrate, in this case, up to 12 cell layers. And this is the histology, again with HA, and you can see that it correlates very well with the fluorescence from the particles, indicating that it's binding HA. This is the blow-up. So I did a small test in vivo, and I saw the same thing. And here you can see a cross-section, so it's a large tumor that's cut in half. And you can see that the particles penetrate quite deeply into the tumor. And again, there's nothing in the control organs. So the major conclusion is, and the novelty of this work, is the nanoformulation of an enzyme, which already has proven to be clinically relevant and is already being used. So basically, what I show is that it's much better to put that enzyme on a nanoparticle than to use it free. And that has many implications, because it can be used for local, not only intraperitoneal, but for example, local injections of these particles, for example, in pancreatic tumors. And then the other conclusion is that there's strong indications that this enzyme not only degrades the substrate, but has a very strong affinity for the substrate, so that would give us targeting. So we would have a dual function, targeting and degrading the HA. And I want to thank you all for coming, and I hope this is the end of the World Cup.
I'd like to thank Dr. Schodeller for that. It's a wishful thinking from an Italian perspective anyway. We have time for one very rapid question. Well, two. I think we leave the debate, because I know where you're going and I know what you're asking. So can we leave it for wrapping up altogether? Maybe we sit down, because most likely you're going to ask about the hyaluronidase targeting. So quick one.
Well, you got it. Yeah, I was, hello. Okay. I was going to ask you about the possibility that your particles or enzyme would access other parts of the body where hyaluronidase is important.
Yeah, well, that has been studied, and the thing with the nice thing about using hyaluronidase and not some other degrading enzyme is the HA is very rapidly regenerated in the body. So, for example, in the heart, there's very low amounts of HA, and this is rapidly being regenerated. So it's and there are also clinical trials ongoing with the enzyme, and there's up to now they haven't seen a toxicity. So this is I think, a good indication.
I think the aspect of secondary targeting is actually quite relevant, especially when it's circulating. Okay, I'd like to thank